Great. So welcome, everyone. Good evening. And just so glad that you're here. I'm Dr. Annette Sacksteder, naturopathic physician and acupuncturist. And as I said, I'm just delighted that you've joined us for Exercise for Bone Building with Dr. Sherri Betz. And before we start, a few logistics. Tonight's talk will be recorded and a link will be sent out at the end of the week. And if you have any questions, please type them in the and then Dr. Betz will be answering them after the research portion and then at the end of the presentation. Dr. Betz is a physical therapist and Pilates teacher specializing in spine rehabilitation, geriatric orthopedics, osteoporosis, and exercise applications for special populations. She blends a manual therapy approach with her expertise in Pilates and yoga exercise for older adults with balance disorders, osteoporosis, and orthopedic pathologies. Dr. Betz has published numerous articles, book chapters, and videos on the topic of Pilates for special populations. In addition to being an in-demand international conference presenter, online sessions with Dr. Betz on the topic of exercise for osteoporosis, geriatrics, and orthopedic pathologies can be streamed on her websites medbridgeeducation.com and pilatesanytime.com, and I'll put those links in the chat. She's currently working with Academy of Geriatric Physical Therapy to develop a clinical practice guidelines on physical therapy examination and intervention for adults with osteoporosis. Dr. Betz devotes her practice to improving awareness about geriatric exercise, bone health, and safe yoga and Pilates-based exercise through professional and consumer education, as well as through promotion of low-cost community exercise programs for fit and frail older adults. On a personal note, as someone with osteoporosis who is currently working with Dr. Betz, I cannot speak highly enough about her skill and expertise in developing customized bone building programs. The physical and emotional strength that I have gained through our work together has been a powerful contradiction to the feelings of fragility that I felt when I first received an osteoporosis diagnosis. I want to thank you, Sherri, for the important work that you do and for your generous offering and being with us tonight.
Thank you so much. I'm grateful to be a guide for you, and the feeling is mutual. I really enjoy working with you and learning from you as well. So, okay, so I'm looking forward to talking to you tonight a little bit about the research behind the exercise selections for building bone density or recovering from an injury so that you can build bone density. I feel like my specialty is helping people overcome barriers to exercise, because a lot of times you try to exercise, you hurt yourself, and then you take 3 steps forward and 4 steps back, right? And so those are my people. You know, I love working with the people that want to build their bone strength, but want to use a systematic process, a very slow, methodic process that is safe and also effective for building bone. So I'm going to open the slide presentation so that you have some references for the material. So everything I recommend is based on really good randomized controlled trials, systematic reviews, or high quality research. And if I have an opinion about something, I'll certainly share that with you. And sometimes I have some expert opinions that don't have research behind them, but I use my research-based information to guide my decisions in treatment, but I also use my clinical practice skills to make those decisions for patients. Especially, we work together to formulate goals and plans, and it's really a team effort so that I am giving you what you need and helping you get the tools that you need to build the bone density through physical activity and exercise. So I'm going to share my screen now. And I love to start talking about some of the myths that I hear so often from patients coming in saying, you know, I've always had the conception that if I don't lift more than 20 pounds, or I've been told to not lift more than 20 pounds so that I can protect my spine from fracture. So unfortunately, that is not the case, because if you avoid lifting and you avoid strengthening your back and you avoid loading your bones, they actually continue to decline. So they really need that strength and that loading, that pulling of muscle on bone in order to stay strong. And in order to build bone, you really have to load it. You can't just do body weight exercise. You can't just walk. You have to actually load your spine and load your hip in order to build it. And I'll be sharing with you lots of ways to do that today. The other thing I hear a lot is I'm getting another resurgence of the weighted vest. So years ago, there was the walk vest, and it was so popular and everyone wanted one, and all the doctors were recommending walk vests, and everyone was saying, oh, I got to get a weighted vest and I'm going to walk in my weighted vest. There's influencers on Instagram telling people to wear weighted vests while they're doing their household chores. There's literally no evidence to suggest that walking in a weighted vest is going to help you. The reason why is because it's so limited in how much it can load. And the other thing is if you can walk more than 10 steps in the weighted vest, you are actually doing endurance training and not strength training. So I'm going to show you something. I know the picture is really small right now for where I am, but I'm going to show you one of the first papers that was published by Christine Snow in 2000 using a weighted vest for strength training and preventing bone loss in postmenopausal women. She also is the first to do jump training, jumping off of a Reebok step, doing impact training for postmenopausal women, and found good results with it. But she was using the weighted vest to load the bones like a weight bearing, or like as if they were lifting weights. And so that's kind of the way she was using the weighted vest. And that's the only study that actually showed some good results with that. But really, they're using it to load the spine and load the hip. And there are situations where I've recommended a weighted vest, but it is usually when somebody has a wrist fracture and can't lift weights with their hands. So if you have an injury to your wrist, you can put a weighted vest on and do your strength training, your squats, your lunges, things like that in the weighted vest, and get some benefit and try to maintain your strength as you're healing. The thing that keeps me awake at night is wondering if exercise really can increase bone density in the older adult and also in all adults. And what does the evidence say? So let's take a look. One of the best papers that has recently been published is a systematic review by Benai in 2023. And I want you to notice there's a couple of authors in here, Kistler Fischbacher and also Watson, who worked with Belinda Beck at Griffith University in Australia as their PhD students. And they were her PhD students. And you might know about the Lift More trial. And those three papers, Kistler Fischbacher, 2021 here, and a different paper here based on the same exercise program. And then Watson's 2018 paper was one of the first that was published on the Lift More trial that included high intensity strength training and impact training. And what all these studies look at impact training. And I'm just going to kind of go into each one, just touch on each one. So again, the Kistler Fischbacher paper in 2021 is based on the Lift More trial. It is a 40-minute, twice a week, again, on non-consecutive days, meaning like Tuesday, Thursday, or Monday, Wednesday, or Monday, Thursday, that there's at least one day in between, twice weekly for 8 months. They did low intensity exercises for 40 minutes on non-consecutive days, twice a week for 8 months. So this was showing a positive correlation between the maximum weight that the students lifted and changes in the lumbar spine. So meaning that the students that increased their weight the most or that lifted the most had the best changes in their lumbar spine in the high intensity and resistance training group. And so again, they compared high intensity resistance training to low intensity exercise. So it was like stretching and walking and some little non-weighted squats and lunges and things like that. That was considered to be low intensity exercise. The high intensity group showed significant improvement in indices of fracture risk. So they showed higher bone density in the lumbar spine and in the hip. And you're going to see down here, Watson's paper was basically based on the same exercise program, they're saying it was 30 minutes twice a week for 8 months. So in Kistler's program, they increased the time for the students to 10 extra minutes, but basically was the same program. And again, they did the deadlift, the overhead press, and the back squat, where you have load on the shoulders. And then they did 5 sets of 5 at an intensity of 80 to 85%. So what does that mean? An intensity of 80 to 85% means that you get to fatigue within 5 or less repetitions. And if you are exercising, say, at a lower intensity, it means that you can do 8 to 10, 8 to 12 repetitions at a lower intensity, meaning there's not as much load, you don't get to fatigue as quickly. And then if you can do, say, 15 to 20 repetitions of any exercise, that's going to mean that you are exercising at like a 40 to 60% intensity. This is what we usually use for rehabilitation. If somebody is injured and we're trying to help them recover, we will do higher rep, lower weight exercises at first, and then progress them as they get stronger to a load of an amount that's going to bring them to fatigue within a smaller number of repetitions. We don't really go lower than 5 repetitions for anyone, and we never start with that either. So my program starts with 8 to 10 repetitions, 3 times 10 for about a year. It could be less, it could be more, depending on how you're doing with it, until you get used to the whole program. And then you're going to migrate into doing, say, 4 sets of 8, 4 sets of 6 to 8 repetitions. And then, say, the third year that you're doing your strength training program, you're going to drop down on the reps and up on the weight, and you're going to do 5 sets of 5, and that's what's going to match the lift more. I just feel like if you're not in a controlled trial and not in a study, you don't need to rush to get there. So don't be afraid of all this high intensity exercise, because anytime that you start a new exercise program, it is going to most likely have effects in your bone and changes in the architecture of your bone and the density of your bone. And so the nice thing is that if you've not been exercising and you start any kind of exercise, the first year you're probably going to see some results, and then you can gradually ramp up the intensity of your exercise safely so that it works for you and you don't hurt yourself. So Multanen is another researcher that did a jumping exercise program, and this one was really interesting, doing multi-directional kind of aerobic and step aerobic exercise, which I think we really need to bring back step aerobics. That's such a good form of exercise for coordination and getting a little jumping in there. And it really needs to come back in vogue, but it's not right now. The bone mineral content of the femoral neck was significantly greater in the exercise group in this particular study. And one thing I would like to mention is that what I'm seeing a lot of is that the high intensity strength training, lifting weights and things like that, seems to have the best effect in the spine. And then adding the impact training, like a little bit of jumping or hopping, if you can do that, it seems to have the best effects in the hip. And so a combination of those two seems to be the magic kind of formula for building bone density in postmenopausal women and older adults in general. So Hetchin did a high impact weight bearing, high intensity exercise, and high velocity resistance training. That's another factor. It's like, how fast are you moving? And power training is another one of those concepts that Pino looked at in their program. And it's basically how fast can you move the weight? And, as you move faster, it's an indicator that you're stronger and there's more pull on the bone. So that's something that's being considered in some of the research that's going on for exercise and bone health. And then Aberridge looked at a high intensity jump-based aquatic exercise program. Now, in the past, most aquatic studies that I've seen, and I've been looking at this for years, have been showing that people that do aquatic therapy actually lose bone density. The interesting part about this paper was that one study showed an increase in bone density. So Aberridge showed really good results in bone density. And then Morea's study actually showed no changes in the exercise group. But they did see a reduction in the control group. And that's what you'll see a lot in these papers is you'll see a reduction in bone density in the control group that's not doing the high impact weight training or that's just doing usual activities. and either a maintenance or an increase in those that are doing exercise. Basat did a high impact exercise program for 60 minutes 3 times a week. And then they also did strengthening exercises for 60 minutes, 3 sessions a week for 6 months. And there was a significant increase in the bone density at the lumbar spine and the femoral neck. FN is femoral neck. And in the high impact group compared to the strengthening group. So looking at those 2 groups, there was a high impact group compared to a strengthening group. And they seem to see a better outcome in the high impact group. And then Sanudo did a systematic review looking at 10 different studies of all different kinds of exercise, including vibration training. And that's something that people ask me a lot about. What do I think of vibration training? Now, I haven't seen compelling evidence about the vibration platforms that show excellent results in building bone. And the concept behind the vibration platform is that you get on it prior to doing some exercise, at least 10 minutes prior to doing exercise. And what it intends to do is, like Dr. Clint Rubin, who's a vibration specialist who developed the vibration platform for the NASA astronauts. When they go up in space, they use the vibration platform to try to maintain their bone density. And what he says is that it makes the osteoblast more mechanically sensitive. So if you vibrate your bones before you exercise, it may make them more sensitive. There was a study that was looking at vibration versus the high intensity strength training in Australia, and they did not publish the results. I'm not sure why. I have some theories about why they didn't publish the results, but they were never published. I talked to Belinda Beck about it, and she said, yeah, they were not going to publish the paper, unfortunately. So maybe they will eventually, but at this point, they're not going to publish it. Okay, so I mentioned the Lift More trial, and again, that one I'll go into a little bit more detail here. So in this particular trial, this is what I base a lot of my strength training on because they really had great effects. They're continuing to look at people. They're not just stopping with this particular intervention group of 100 subjects or 49 intervention subjects and 52 control subjects. They're continuing this research ongoing. And it is, again, 8 months, twice a week, 30 minutes. It's important to note that each participant received 2 months of training of the 4 exercises with no resistance. And that is something that I love doing too. And I'll show you some of the things that I recommend that you do to get ready to do deadlifts, squats, overhead press, and make sure that you're doing it correctly. Because if you get off on the wrong foot with strength training and you keep increasing load and you're not really doing in proper alignment, it comes back to haunt you. If you are getting heavy in the weight and you have some, malalignment in the spine, especially, or the hip, and you don't want to load your spine or your hip in an less than ideal alignment, so in a rounded posture. So we'll talk about how to get more aware of your body and how to know if you're in the right alignment. So again, they did a warm up of 2 sets of deadlifts at 50% to 70% of 1 repetition max. So that means that you're doing about anywhere from 25 to 30%, maybe 50% less than what you're actually going to lift for your actual set. So I think of like a set of 10 with no weight, and then a set of 10 with half the amount of weight are your warm-up sets. And then you're going to go into your sets that count. So your 3 sets of 10 of your deadlift, your back squat, your overhead press will be the next thing that you do. Or it's going to be 4 sets of 8 or 5 sets of 5. So a beginner does 3 sets of 10. And then Belinda Beck always says that please use your clinical judgment as to how to get someone started. And so she always thinks that, the clinician or the person that's training should use their judgment as to how to modify the exercises and how to get someone introduced to the program. So she's a big fan of supervised exercise. All right, so then the 4th exercise is impact loading. And so I find that this is a little bit difficult to do at home. So she did a pull-up and then a drop from the pull-up bar. So they go to a pull-up bar, they pull up, they kind of jump up, and then they lower themselves down and then drop to the floor just a few inches. And you start off with a small amount and then you increase. I just find that this is a really tough thing to do at home and to monitor. And, I don't really want somebody jumping up and then hitting their head on the frame of the door, So what I do is a combination of a bunch of other studies doing the step off of the platform. You'll see my platform back here that I use for my classes. And then we do hopping on one leg. We do hopping on two legs. We do preparations for jumping if you're not ready for jumping. So there's lots that you can do that will mimic some of these impacts that are helping to stimulate bone. So what I wanted to point out here is the results from this trial is the lumbar spine increased by 2.9% in the high intensity and resistance training and impact group. And then the femoral neck increased by about 0.3%. So this is one of the reasons that I add additional impact training techniques and types to the program, because I felt like the femoral neck was not getting enough stimulus in this paper. And then this is something that Belinda Beck is very aware of and is kind of exploring with future research. So you'll be looking for more research coming out of Griffith University in Australia. And then the controls, interestingly, they did just low intensity exercise without the extra weight, and they actually lost bone density. So they were exercising, but not to the intensity, of course, of the exercise group. So they lost 1.2% bone in their spine and 2% in the femoral neck, which gives us a net gain of 2.3% in the exercise group. So they're not losing bone and they're gaining a little bit. So this is great for exercise, because exercise doesn't often have the kind of dramatic results that some medications do. So here's again a schematic of the amount of bone that was gained in the lumbar spine in the exercise group and in the hip here, and then how much was lost in the control group. So another study that I like looking at is Montgomery's study from 2020, where they did 12 months of 3 times a week high impact training with jumping sequences. So they were basically told in one group to jump as high as possible and try to do 15 jumps in 1 minute. And that's not a lot. You could just do like 1001 jump. And then, it's like 1 every 4 seconds or so. And then the interval jumps were done at 30 total at 4 per minute. So there's a lot of rest in between. And guess what? That group had a lot of attrition. They dropped out. Not a lot of people stayed in that study. It was just really hard to manage, standing around and kind of waiting and then, okay, got to do another jump 15, 30 seconds later, So that was kind of tough, So the interesting thing about the evidence was that both jumping groups did well. So they recommended that you go ahead and do the shorter version, the 15 jumps per minute, jumping as high as possible. And the control group, they did no jumps, and they saw a pretty significant reduction in the femoral neck and the lumbar spine of around 3%. Allison's study is the most interesting study that I'm going to share with you tonight. What they did is they took 35 healthy men that were community dwelling aged 65 to 80. They did a 12-month program, 7 days a week of multi-directional unilateral hops. So what that means is they had the men jump on one leg only for 1 year. So I wonder how their back was at the end. What a tough study to be part of. I just wonder how they did as far as weakness on the other side, but maybe they were doing other things. I don't know. But anyway, so they jumped on one leg in all directions for 1 year. And they saw an increase in the femoral neck bone density by 0.7% in the exercise leg and a decrease by almost 1% in the control leg, which represented like a 1.6% net gain in bone density of the exercise leg. So the nice thing is it's one person. They have the same nutrition. They have the same habits. It's like they become their own control group, which I think is a really interesting way to conduct a trial. And it's a very unusual way to conduct a trial. And so they also noticed that L4 increased by about 1.8%, but L1 through 3 didn't really change significantly. So they were interested in this study, so they repeated it. And they again used about 34 men, different men, that did a 12 months, 7 times a week, again, 5 sets of 10 multi-directional unilateral hops that totaled 10 minutes with 15 seconds of rest between the sets. So we don't do this whole program in my training that I give people in my classes, but we do a version of it. And we are doing multi-directional hops, front, back, side to side, and then diagonals. And then the people that can't really do the hops yet will do stepping with a heel raise, side step, little squat with a heel raise. So we get you ready for that if you're not ready for it. And one of the things that I always recommend to people before they start any kind of impact training is you need to be able to lift about 40 to 50 pounds off the floor. And that's just in like a box or a suitcase, something like that. And you need to also be able to do about 20 heel raises in a row. Now, this is my criteria. It's not based on any research. It is just because I really feel like the person needs to have a good support system of musculature around the bones if you're going to vibrate them, right? If you're going to do impact training, you have low bone density. If you have poor strength, you're not going to be able to absorb those forces as well. And I think it's really important, especially that you not have any back pain, you don't have knee pain, that you're basically healthy and ready to add this type of training. If you're not ready for it, I'm your person to help you get ready for it. So, or somebody like me can help rehabilitate you so that you can get strong enough to be able to do these activities. And so I have some criteria and skills that I love for people to master before they start doing loading. And we'll talk about those in just a moment. Again, another study on high impact training is done by Tucker in 2015. And this was 60 premenopausal women who exercised twice a day, 6 days a week for 16 weeks. So this is kind of an interesting study that it was a short one. And most studies, almost no studies, show bone density changes within 8 weeks. Most studies and most researchers recommend doing at least 8 months because it takes a long time to show bone density changes. But this study kind of refuted that. In 8 weeks, the jump 10 group did 10 jumps with 30 seconds rest between each jump, and they gained 0.29% in their bone density of the femoral neck. And then the jump 20 group did 20 jumps with 30 seconds rest between the jumps, and they had a significantly, higher percentage of increase at the femoral neck, 0.91%. The control group did stretching of their legs only and lost about 50.51%. At 16 weeks, what you'll see is that the gains are the same between the jump 10 group and the jump 20 group. The problem with the jump 20 group was the same as the other group that had to wait a long time between each jump and had to do more jumps. They lost a lot of the subjects. They quit, and I think they got a little bored with it. And I always feel like you have to keep people moving and you have to keep them going and you have to keep them interested and inspired, to continue. So it's kind of hard to do a very slow moving program like that and have that much rest in between each jump. So they recommended at the end of the study that if you're going to do the study, you're going to eventually end up at the same place. So whether you do the jump 10 or jump 20, you're going to have about 0.5% increase in your bone density. And the authors recommended the jump 10 program due to shorter time to perform and improved compliance. All right. One of my favorite papers to recommend to my students who are not researchers and the patients that I see is this one by Benedetti. It's just a really well-written paper. It's easy to understand. It covers most of the types of exercise that may have effects on bones, such as walking, progressive resistance exercise, high impact exercise, strength training, and vibration platforms. And so they give you a good summary of all those types of exercise based on current evidence. So it's just really nice research review paper. And then Alonso Perez and Holubiak also did some review papers that talked a little bit about short bouts of high intensity exercise followed by rest periods are really important. So you want to kind of surprise the bones. One of my colleagues always says a strong signal coming fast is what bone responds to the best. So if you did like 5 minutes of high intensity exercise and then you rest, for either, an hour or more, seems to be the best effect. And putting on wrist and ankle weights doesn't actually enhance the effectiveness of exercise on bone density. So there's no reason to walk with wrist weights on or walk with ankle weights on or do anything with ankle weights on other than do a bicep curl that brings you to fatigue within 8 to 10 repetitions. So remember that more repetitions does not equal more strength. It equals better endurance. So heavier weight that's harder to move sooner is going to build strength. So strength as compared to endurance. Remember, endurance is low-level activity done many, many times. Why walking, hiking, and some of those repetitive activities don't really build bone density because they're not high enough intensity. You're doing hundreds and hundreds of repetitions if you're doing steps or cycling or even swimming. The seated leg press machine has also been shown to be very effective at targeting the proximal femur and does better than walking or even running exercise. There's a lot of controversy about running. Some studies show that running builds bone and some doesn't. And running too much actually has a detrimental effect on bone. And so you have to kind of find that happy medium. And I usually tell people, like, if you keep it under 20 miles a week, so maybe you're a 5-miler, and you run 3 times a week, 5 miles, that's probably going to be okay. If you're training for a marathon or training for triathlons and you're running longer distances, that's probably going to not have the greatest effect on your bone. So let's look at these studies that compared 2 different types of exercise. So a lot of people want to know about Pilates or yoga versus high intensity strength training. And Dr. Beck's group, conducted by her PhD student, Kissler Fischbacher, looked at Pilates versus the Lift More trial, and they found that the Lift More program actually showed increases in bone density, and the Pilates group actually lost bone density. So unfortunately, that was not enough to build bone. And one of the things that we think about Pilates mat exercise, not necessarily equipment, this is mat, is that you're only moving your own body weight. So once you get strong enough to move your body weight, I would find that when I used to teach Pilates, and that was what I thought might be building bone density years and years ago, like 20 years ago, when I first started doing this work, even more than that, longer ago than that, I thought that Pilates may be building bone density. But what I was finding was they would build bone the first year, second year they would plateau, third year they would decline. So it would be like they would progressively kind of get used to the Pilates mat work because it was only body weight. And you're already moving your body weight and you're repeating the same exercises over and over again. And abdominal exercises don't really load the spine or the hip. So, the abdominal exercises are hard, but they're not really building bone where you need it. You need to be on your feet. You need to add resistance in some way in order to build bone in the spine and the hip. Then there's a program called OsteoStrong, and I know a lot of people look at biodensity machines or the OsteoStrong machines. Biodensity brought in Tony Robbins, and they did a big, marketing sort of overhaul, and they renamed the biodensity machine the OsteoStrong machine. And it's also called intermittent isometric axial compression. And what they looked at was using that machine to compress the spine and compress the hip. So they did like a leg press machine, they did a pull, they did a push overhead, they did an abdominal kind of thing. And so there's 4 different exercises where they're pushing and pulling in all directions. And then they're only holding it for a few seconds and they're trying to do as much as they can. So it's kind of like doing 1 repetition maximum against that resistance, and it measures the amount of force that you can produce. And unfortunately, they did not see any improvements in bone strength at any of the skeletal sites that were examined. And they thought that maybe it could mitigate age-related bone loss at the distal tibia and the radius, which is where the only places that they saw any changes in bone. Okay, so then the body pump, and I've also seen a lot of injuries with the OsteoStrong program. I've seen rotator cuff tears, back injuries, disc ruptures, fractures, things like that. So it's not something I would recommend for a beginner. if you want to add something like that, what I think you need to do is go through a really good strength training program with focusing on alignment, something like what I'm going to suggest to you today. And then you add that at a later date. And you don't want to start with something like that because it's not going to really help your function and your control. So I really think that no matter what you do, you need to learn the skills that I'll be recommending. And then Nicholson looked at Body Pump, which is a Reebok kind of program where it's focusing on high reps, low weight. So they do like they have these little barbells that weigh less than 20 pounds, and they're doing like 15 to 20 repetitions of most everything. And so it's a lot higher reps, and they're looking to kind of burn calories. And what we found with this program versus a control group was that there were no changes in the lumbar spine in the Body Pump group. And there was also a significant bone loss in the control group. So we know that not exercising is going to result in lower bone density or bone density decreases. But they also noted that total body bone density was decreased in the Body Pump group also. And what, the Body Pump concept was to burn calories mostly and, use dumbbells and little barbells and things like that in a group setting. So it was like a big studio where 20 people were exercising. They were doing what they called strength training. But what they were really doing is more endurance training. And the newest research is showing that weight training, high intensity strength training actually burns more calories than low intensity, high resistance training, high rep training. So anyway. All right. So one of the other papers that I think is a really nice paper to give a little summary, I just wanted to kind of share some of these concepts with you that in order to make your bones or stimulate your bones, or what we call osteogenesis, you have to do something more than you do on a regular basis. So if you just get up in the morning, take a shower, wash the dishes, go grocery shopping, maybe do a little light yard work, and you do that over and over again, and you do the same things over and over again, you will progressively decline in your strength, and you'll also decline in your bone density. So usually that goes hand in hand. What we know, if we don't exercise to build strength in our legs or to maintain strength in our legs, there's no such thing as maintenance as well, is that you're either progressing or regressing. So if you're not doing progressive resistance training somehow, an overloading, you will lose strength. And what we know is that most postmenopausal women who don't focus on exercise for strengthening their legs will lose 1% of their leg strength every year. And that's why suddenly it's like, I can't get out of chairs. Like, what happened? I didn't do anything different. And then I'm having to use my hands to push up out of chairs, or it kind of sneaks up on you that you don't realize that you're using your hands to push yourself up. Or you're noticing that it's a little harder to climb stairs. It's kind of sneaky like that. So we also note that power training showed better effects than strength training in some of these papers that they looked at. And again, that is the ability to move weight quickly. And then strength is basically just the ability to overcome resistance in general. And power is the ability to overcome resistance in the shortest amount of time. So some of those concepts are important. And another important concept that I wanted to share with you is swimming, cycling, walking doesn't really provide adequate stimulus to bones. So if you have low bone density and you want to pick some kind of endurance training, I would pick walking, rapid walking, brisk walking, running if you like that and you can tolerate it, or hiking. That's another great type of exercise. And then any of the standing gym equipment, you can do Stairmaster, elliptical, treadmill. Any of those are good choices for cardiovascular exercise. And again, that doesn't count as your bone stimulating exercise, right? That's something you do for your cardiovascular system. That's something you do daily, and like 20-minute prolonged cardiovascular stimulus daily. And then your strength training is done 2, minimum 3, ideally days a week. And it can be done in like only 30 minutes. Another paper that I love, love, love is Koshi's paper. It's a little bit more recent, and they did some great research on pulling together trials that positively impacted bone density in postmenopausal women. And they also suggest that high impact exercise seems to have the most significant effect on bone density due to compression, shear stress, and high loading of the bone. All right, and these are just some of the papers that were in there. I wanted to kind of give that to you if you want to look at some of those specifically, and you can see all the different types of papers, including whole body vibration and strength training and impact training. And this was the paper that we did publish that is the clinical practice guideline to help physical therapists in the management of patients with osteoporosis or suspected osteoporosis. And what we did is we put together guidelines for them to suggest exercise that was going to be effective for postmenopausal women and premenopausal women. So we have static weight-bearing exercise like single leg stance that has been shown to slow the decline at the hip in postmenopausal women, and it has no effect in premenopausal women. So it's a good thing to do balance work, but it's not going to build bone density in a premenopausal woman. You've got also dynamic weight bearing with low force, and that's going to be something like walking or Tai Chi or dance, where you're not jumping, you're just, staying on the ground, low force, and that can slow the decline at the lumbar spine in postmenopausal women and has no effect in premenopausal women. Then you look at dynamic weight bearing exercise with high force, and that's going to be like jumping and high impact aerobic activity. And then that's going to be shown to slow the decline of the femoral neck in premenopausal women. And it is shown to have no effect in postmenopausal women because the studies that were in this particular paper actually didn't show any, they didn't have any studies that were doing jumping in postmenopausal women. They do now, but in that particular time frame where we were looking at some of the evidence, there were no papers that were including that. So that is one of the things I wanted to point out. So again, non-weight bearing exercise with low force, like Pilates, yoga, mat work, things that you're lying down and doing exercise, doesn't have really any effect in the bones of postmenopausal or premenopausal women. And then non-weight bearing exercise with high force, and this would be something like doing leg press at the gym, hip ab, leg extensions, things that are, loading your body that you would do maybe at the gym or on equipment, that would be shown to slow the decline at the femoral neck and the lumbar spine in postmenopausal women and positively impact the lumbar spine in premenopausal women. The good news is that any combination of exercise types, if you do a lot of different combinations of exercise, can slow the decline of bone loss in both postmenopausal women and also actually increase bone density in premenopausal women. It definitely depends on estrogen, and I always think of estrogen being your fertilizer for bone. And so as soon as you start losing estrogen in your system, you have to work really hard to maintain your bone density because it will usually decline quite a bit during menopause. So these are just some summaries of what I mentioned, and just the most important thing when you are starting your exercise program or thinking about exercise is to protect your body from fracture. And the way we're going to do that is going to be using a broomstick. So if you happen to have a broomstick around, it would be great for you to grab one if you have that, because I'm going to show you some hip hinges and things like that we can do to help to become more aware of our spine alignment and our posture. You also want to consider treatment for pain and biomechanical dysfunction. So if you have that, then you got to deal with that before you try to do bone building exercise. You also want to learn what we call spine sparing strategies. And this is just basically being able to pick things up off the floor, being able to get up and down off the floor, get things out of a low cabinet without compromising your spine. And then you want to avoid deep side bending, deep rotation and flexion of the spine so that you're not compressing the vertebra. And once we get out of the slide presentation, I will show you that. And then once you can do all that, then you think about beginning your bone building program. And then here is a poster that is actually on my website. So if you go to therapilates.com on the very first page, you scroll down, You can click this poster and it has all the different, suggestions for lifting, doing everyday activities at home in the right alignment, and then also kind of modifications for exercise. But since I'm going to show you some of these things, we'll move on from there. And then your contraindications for exercise are going to be all roll-ups, all forms of crunches, abdominal work with oblique rotation, pressures on the rib cage. So you're using a pillow if you're lying on your stomach and doing any lifting exercises like extension. You want a pillow under your ribs. And then forced external rotation of the hip in standing or in floor exercise. Like this pigeon pose, this is external rotation of this front leg. You don't want to force your body to rotate through that hip. If you're stiff, you could cause too much torque through the neck of the femur. So you want to be careful with that. All right. You need to target your fitness level. Do you need assistance to get down to and up from the floor? If so, you'll need chairs, props, and some balance poles to begin safe and effective exercises. If you're already a fit athlete, these questions would be important. Can you stand on one leg? Can you rise from the floor without assistance? Can you safely lift 20 pounds from the floor? If you're trying to do an impact program, you want to ask yourself, can I lift 40 to 50 pounds from the floor? And can I stand on one leg and do 20 hill raises? Those are the kind of things that you want to think about. Okay, so we're going to start with this neutral spine awareness activity. I'll demonstrate that. And if you want to participate with me, I will be happy to watch you be able to do that. Okay, so the first thing that I think that everyone needs to do before they start any kind of an exercise program is to find out, can you actually lift or touch the floor and lift something off the floor? So I think of a lift from the floor like trying to be able to lift with two hands, right? So a deadlift, I know a lot of people are like, wow, deadlift, what is that? And how do I do that, right? And should I be doing that? A deadlift is just when you're trying to touch the floor and lift something with two hands. If you can lift with one hand, it's small enough usually that you can manage it with one hand. You can always put one hand on the floor and then lift and pick it up here. You can slightly rotate your spine, but you're not rounding your spine to get there to pick it up. So what you want is to be able to keep your spine in alignment so that you're stacking up the vertebra. There will be curves, and that is normal for your curves inward at your neck and the inward curve at your back. And you want to honor those curves so that when you are hinging forward, that you're not moving any of those vertebrae, that they're staying stacked up. And when you bend over to pick something up, you're not compromising your spine. If you have low bone density, the low bone density is usually in the vertebra. And this is where your trabecular bone is, and it is more susceptible to fracture. And what happens is if you bend forward to pick something up, or even if you just bend forward, you're coughing or sneezing, or you just kind of, bend over here to pick something up, it's, the progressive, you continue to do that over and over again. And it's just that last moment that the vertebra can't withstand that force, and you're putting most of the force on one or two segments. And it's usually the one right between the shoulder blades, right, that bends the most. And it's just easy to do. And we do it until something happens. And then we can't really unring the bell. If you get a compression fracture in the mid-back or right in that, vertebra, then the architecture of the spine starts to change. So what we want is to keep the spine in that stacked alignment. And what can help us with that is making sure that we keep the 3 points of contact, your tailbone, your mid-back, and your head against the stick. And then you put your thumb in between the stick and your low back. And then you try to hinge at the hip. You can just sit and do a little kind of rock back and forth. And you're trying to make sure that you're not smashing your thumb. And then we touch the floor here. Okay. So I want to stop there for just a moment and be able to ask you a few questions and or let you ask a few questions and see where we are with the material. And let me look at the chat and see what you're asking.
There's one asking about Zumba as exercise.
Mm-hmm. Yeah, so that's an interesting concept because Zumba, you do a little bit of jumping, and I find that there's a lot of, pelvic movement. It's like a combination between samba and hip hop and, kind of very Latin dancing and things like that. So I have gone to Zumba classes before, and I felt like in my opinion, there wasn't enough warm up and cool down, and there's a lot of spine movement. I don't think that there's a ton of contraindicated movements necessarily, but I would just, beware that you don't twist and reach and round your back. It might be a great form of cardiovascular exercise. I think it's good for coordination and good for, your balance, and, it definitely gets your heart rate up, and you can certainly use that as a type of cardiovascular exercise. But you just want to be sure that you're not rapidly twisting or twisting combined with rotation. Okay.
And another one is about rebounders.
Mm-hmm. So there is one study by Posh. I'm going to put that in the chat. Posch. I almost put that into the talk, but I was trying to cut it down a little bit, so I didn't talk so much. But anyway, Posh in 2019, if you look up, I think they called it mini trampoline, but either go rebounder, or I think it's called mini trampoline. And what they did is a 45 minute class. It was like 45 to 60 minutes of like jumping and squats, and they did all kinds of exercises, balancing. They threw a ball back and forth. It was a lot of different kinds of exercise on the little trampoline. And I think they got an increase of 1.6% in bone density, but you had to do it like it was either 3 or, I'm trying to think, I think it was more than 3 times a week. I think it was like 5 times a week or 6 times a week. And you had to do like 45 to 60 minutes of that. And so I think you can get more bang for your buck doing something different. But there's also lymphatic benefits with jumping on a trampoline. So there's, lymphatic stimulation and things like that. So if that is of interest to you, it might be something you could throw in there a 4th day of the week. You wouldn't have to do, 5, 6, 7 days a week of that, but it would be something that you could just throw in there as an adjunct to your program if you enjoy doing that. And if it's something you like doing, for your cardiovascular fitness, you can certainly do that. But I would be still mindful about alignment, and I would make sure that I'm strong enough to lift weight from the floor, because that means your back is strong. It also, I also think that you should be able to do good, calf strength heel raises, so that you have the ability to withstand those forces coming down through your body. So
another question. One of the studies mentions flat foot landing from pull-up bar. What do you think about jumping rope?
Yeah, and I don't really like the flat foot landing, because if you are landing flat foot from a pull-up bar, it's so jarring. It is incredible. You do get a lot of vibration through the body. So I always tell people to land with a little bit of a toe ball heel. They also recommend straight leg heel drop in some of the Onero training. That's kind of an offshoot of the Lift More program. And I like to do them with slightly bent knees. And I feel like you get plenty of vibration through your body, and it's like a preparation for doing impact training. And so jumping rope, I think, is a great form of cardiovascular exercise. You're only jumping like half an inch. So there may be some benefits to that. But I think most of the studies say that you have to have a ground reaction force of about 3 to 4 times your body weight. So most of the studies show like 3 to 4 times your body weight, so that you're jumping high enough to get the ground reaction force to increase, so that you stimulate your bone. And so you might not be getting that with a jump rope, but it could be a good form of cardiovascular exercise, because it's hard. It's hard to do that endurance wise. I know.
Okay, great. So this is, I know, not really the focus, and I want to just let people know, stay tuned for further webinars and emails with me, but someone did ask about calcium and vitamin D supplementation. So if there's anything specifically about your exercise like to speak
I
to?
would say calcium and magnesium is really important. I feel like you are going to be such a great resource for that. But having enough nutrients so that you're not, I like to say, like robbing Peter to pay Paul, because if you don't have enough calcium and minerals floating around in your bloodstream and you're exercising, your muscles require calcium to contract. So they're going to pull calcium from your bones to allow those muscles to contract and to give them the tools that they need to create that contraction, because calcium helps muscles contract and magnesium helps muscles relax. And so that's why they say, take magnesium for muscle cramps and relaxation, because it will help those muscles relax. And so that being said, you want enough available calcium floating around in your bloodstream so that you don't have to pull calcium from the bones to feed your muscle contraction. So you do have to eat more healthy when you exercise, because you're using more nutrients to make your muscles work. And then the other thing is that I think a lot of people don't realize that vitamin D is so important for your bone health, because it's one thing about vitamin D deficiency is one of the signs of vitamin D deficiency is muscle weakness or leg weakness. And the other thing about vitamin D that I think that's not well known is that vitamin D helps with muscle contraction, of rapid muscle contraction. So that would be your fast twitch fibers. I'll get that out in a minute. But your fast twitch fibers are stimulated by vitamin D. And that's why they used it for fall prevention in a lot of nursing home studies on fall prevention. They would give them vitamin D to help them with fall prevention, because then they could react more quickly to perturbations or to tripping or falling. They could catch themselves more easily if they had enough vitamin D in their system. So that's not just for the mineral part and the bone building part of your bones. It's a lot about muscle reaction and fast twitch fiber production from vitamin D. And you want to make sure you have enough so that you get that fast twitch fiber.
That's great.
Working.
And just one last question, gyrotonic.
Yeah, gyrotonic. Yeah, I'm actually a gyrotonic teacher. I did the gyrotonic training. I did gyrokinesis training, and I did gyrotonic training with Julia Horvath, and I also did it with Deborah Rose and all the girls out in San Francisco. It was fabulous. I don't think that system is going to have effects on bone, because they don't load, right? I mean, you're doing very similar things to Pilates. You're using the paddles, you're using the pulleys and things like that. And there's wonderful movements and there's a lot of spinal mobility things. But I don't think that in and of itself, what I learned, which I have not studied it lately, so they may have done something new lately, but I don't think that system is going to be something that's going to build bone. I don't think it's a bad system. It's a beautiful movement system, and it's very flowing and gorgeous movement, and it's fun to do. And I really feel like it's great for mobility and control of your body, but I don't think it's going to be enough for building bone. Just like Pilates, the same thing. You really have to add to Pilates, yoga, or gyrotonic or something like that in order to build bone density.
Okay. And one last question about Pilates. If someone's using a reformer, can you speak to that in terms of bone building?
Yeah, so the reformer, I actually have a DVD that I created called Reformer for Osteoporosis. And I did a strength program for the reformer for Pilates Anytime as well. If you're a member of that, you might be able to see that on there. But I really feel like the reformer, the leg press or the footwork series is a good one to start to load the spine. But the problem with it is when you're lying down on the reformer flat and then you're doing the leg press or the footwork, you can load up the reformer. If you have the spring loaded one, you can put all the springs on, and then you can also put put it on the second gear to get a lot of loading. You can also do single leg press. You can increase the intensity of the movement by putting all the springs on. So you're getting quite a bit of load through there. But the problem is you're going to get a ceiling effect, because once you put all the springs on, that's it. You can't go any further. You're not going to be able to go any more than that. And most people hit that ceiling very quickly. And then the other thing is you're lying down, so it's going to mitigate the loading through the spine, so that, you've got your shoulder blades on the mat, your back of your ribs, your pelvis. So those forces are going to kind of get less and less as you go up, because they're getting mitigated by the pressure on your body, on your bones, on the reformer. So you really need to be vertical with load coming through the shoulders, so that you're doing either, like the back squat with a load on your back like that. And then you need to either be doing a box lift. So something like this is what we start with, is we get just a plain old box that's like a less than 12 by 12 inches. You don't want it to be too big. And you start doing loading like that. Now, there's almost no exercise in Pilates that loads like this. Like, everything is unloading the body. So you've got the springs from above, or your springs on the reformer. You're, pulling them down, but in most cases. Now, you can do an exercise that I really like called pulling straps. You're lying on the box, and then you're pulling, and you're prone like that, and you're pulling with your arms and lifting your chest, and you're working your back. That is a great exercise to do that may have some benefits. And then the splits, the front splits, side splits, all the split series may have some benefits. But again, you're not having any load coming down through your hip. It's just your own body weight. And so there may be, mild benefits to that, but I think it is going to be limited. And so when we do reformer work with people, I say, okay, do a reformer class once a week and do your strength training twice a week. So you can always throw it in. If you love it, you can throw it in and put it in as a third day of the week or fourth day of the week exercise program, and do something that you enjoy. So maybe like a Tai Chi class, or some of you said Zumba, some of you, might be playing pickleball or something like that, so you're doing something else, but you're making sure that you're getting that minimum of 2 days a week of strength training, and maybe a third day, so I always like to shoot for 3 days so that you get that third day in. So again, the box lift like this, you can just start putting weights in your box. You start with 10 pounds or less, and then you can transition to the floor and look at the difference between here versus here. So that's a big difference. You have to really be able to flex your hips, and sometimes you have stiffness in your hips and you can't get there, so you have to use the handle. And it always feels heavier to lift from the floor. And so you can just start your lift like this, touch the floor in between. You're just making sure that you're keeping that spine aligned. And then another really easy way to start the other exercise from the Lift More trial, the overhead press, is to add some TheraBands to your bar. So you've got your dowel that you're using for your balance. I've got these stoppers on the end so that I can put it on a hard floor if I want to work on my balance. And then I can put a slip knot at the end of the TheraBand, put one on one side, and then put a slip knot on the other side, like that. And then that's going to provide my resistance. It's going to be super easy to modulate or modify. And then notice that these are different colors. The blue is heavier than the green, so I'm going to make it a little bit longer so it feels about the same. Then I bring the bar to my chest, and I'm going to press overhead. Bar to the chest and press overhead. So you're trying to get that load over your head. And so you get that load through the spine and the hip. So you're mostly going to feel this through the spine, and you want to make it as easy as possible for you to get that load over your head. So that you can, work your shoulders. And I love the bar because if you pull apart, it helps to decompress the top of the shoulders, where people tend to get a lot of impingement for through the shoulders. Let's see if another question came in. Okay. Karen, unfortunately, when you have lost your estrogen producing organs, you probably are going to experience some bone loss. and some significant bone loss. And it's just kind of what happens as we lose estrogen. But you're still trying to keep your bones strong. The stronger your muscles are, the less likely you are to fracture, no matter what your bone density is. So most fractures occur from a fall, and even spinal fractures, most of those occur from falling. So if you can practice your balance, so doing something like standing with your feet together more often, that improves your posture, you don't slump as much, and you narrow your base of support. And then trying to get to where you can stand on one leg, something like this. And then if you want to go further than that, you can start doing some heel raises. That's a super easy way that usually doesn't bother your hip or your knee. And that's a super easy way to get working on your balance, get working on your calf strength. And then that's going to help you build bone as well in the hip. And the calf is like your second heart. It helps to pump fluid back out of your foot if you tend to have feet swelling or peripheral neuropathy or things like that. It's one of the best things you can do for your peripheral neuropathy is to do calf strengthening. Okay. Any other questions?
And Sherri, I'd like to just add, that not everyone is, as Karen said, able to take estrogen, but everything you've talked about is so important and perhaps even more important. But that's just something that estrogen is important, but we can also look at your vitamin D levels and look at your nutrition, digestion. So don't feel that there's no hope. And sometimes medication is what is needed, and that's not the end. To do it in a proper way.
Every person going through menopause is going to have a decline of about 20% in their bone density during menopause. That is just inevitable. It's just how it is. It's just how it is. Men are going to lose on a more of a slow trajectory, and women have a more sharp decline during menopause. And so whether you take estrogen or not, what you want ideally is to build up your bone bank so that when you do go through menopause and you start to decline, that you have some left in the bank, right? But wherever you are, it doesn't matter, because getting stronger, right, is going to be the key to prevention of fractures, and maybe possibly building some bone. You'll never build more than you had at about age 30. That's when you reach your peak. But most of us don't know what our bone density was at age 30. So we're trying to, as much as possible, regain as much bone as we can through exercise, through nutrition, even better sleep habits, making sure your cortisol and serotonin levels are balanced. And those are some wonderful things to be able to do along with the exercise. Kat is saying, what if you have spondylolisthesis and you have an L5 and sacral insufficiency, fractures with severe osteoporosis? How do you get to building bone? I'm almost 4 months on Tymlos. Are you able to stand up out of a chair without using your hands? And, those are some of the things I would say. Can you? Yes. Okay. Then what you would start doing is maybe holding some weights close to your body and just stand up and sit down with weights in your hands, things like that. I mean, there's a lot of things I would want to do, to evaluate you before I gave you lots of recommendations. But also, there's no reason why you couldn't try standing on one leg and doing some heel raises. That doesn't change your spine alignment at all. And then, really just starting to get to where you can hold something heavy and get out of a chair, and gradually increasing the amount of weight. Now, I usually with people with osteoporosis, I always recommend that you only go up 1 pound at a time. So if you're lifting 5 pounds in your box, you're going to try lifting 6 pounds in the box. If you're lifting things like groceries and maybe a pet or something like that, then if you're already lifting things, then it's a good idea to start practicing lifting properly and really getting somebody to have their eye on you and make sure that you're doing it correctly and that you're not provoking your pain. Because a lot of times what you have is spondylolisthesis is aggravated by extension. And so if you overextend when you do your exercises, that could trigger the pain from that situation. And a lot of times practicing deadlifts and strengthening your back is actually helpful for a spondylolisthesis. Okay. But yeah, beyond that, I really need to see you and be able to watch your movement and see if you have any compensations or anything like that. But I think some of these basic things you can start doing. There's no reason why anybody that comes to me that has a spinal pathology, I don't care what it is, they're going to get this exercise. They're going to learn how to keep their spine in that neutral or optimal position, whatever that is. You know, so it could be, for some of you might be a little more arched than others. Some people might be a little more flattened. It just depends on your makeup and your anatomy and how your spine is formed. Because some people are curvier than others. Some people have a scoliosis. Some people have flatter spines, you know, from doing ballet or dance. So squats and progression and knee protection. Yes. So when you're doing any kind of a squat, I think of a squat being like sitting in a chair, right? Like this, and standing up, right? And so if you're differentiating between a squat and a deadlift, now a squat to me is when you keep your trunk a little bit more vertical. And that does put a little bit more stress on the knees. So I suggest that people with knee pain start with a deadlift, and you want to think of going straight down towards your toes, and then the bar comes right past your knees and it stays as close to you as possible. And what happens with that is that you hardly have any load on your knees, and it puts most of the work in your buttock muscles and back muscles. So you're really using your glutes and your back muscles. When you're doing the squat like this, your knees bend a lot more than when you're like this, right? Do you see how much more my knees bent in that squat position? Because with a squat, I think of my buttocks being the same height as my knees. So what I would start with if I had knee pain is I would definitely do the single leg heel raise and the balancing here and practicing strengthening, because that strengthens the whole leg and usually doesn't bother the knee. And then start doing your deadlifts and save your squats, the back squats, for later. And start practicing these and really get those buttock muscles strong. And then while you're doing that, do the heel raises, get your calf strong, get the rest of your leg strong, because you will work your whole leg like that. You can even start adding resistance with that. You can stand on a TheraBand or add dumbbells in your hands and start adding resistance with the heel raise. So, yeah, so you love the permission to skip the squats until the knee is better. Yes, good.
Sherri, could you speak? I know we're at time, so you just decide when it's enough, but
Okay.
you had talked about if people get cramps in the arch of the foot when doing hip raises, and you speak about how to stretch and prepare for those if someone has cramping.
A lot of people have that. So sometimes it's just too much too soon. And I love to do an exercise called the long stride lunge. And it's kind of a preparation for lunges. So you stand and you step about 3 feet forward. So most people that are between 5 and 6 feet have about a 1 yard or 36-inch stride length. So I'm going to throw a yardstick down so you can kind of get a sense for how long that is. So I've got my left foot back here by the yardstick, and then when I step forward, my right foot is there. I'm only 5'3", and so when I'm in this position, my toes are dorsiflexing a little bit or pulling back a little bit, and I don't have quite as much load on my arch of my foot, because if I'm letting it go down like this and back up, then the plantar fascia is a little bit more stretched in this position, and I don't have as much weight coming down through that foot. So that's one thing I love to do, because you're getting a little bit of a stretch to the calf, and that also kind of goes under the arch and stretches a little bit. And then another thing that you can try doing is getting a little stool and putting your foot on a stool if you get cramps, and So let's just say this foot is the one that's getting the cramps, and I've got this foot on the stool, so that takes some of my body weight off. If you do 2 feet lifting up, that's 50% of your body weight on both feet, so that usually doesn't make you cramp, right? But when you go from 50% to 100%, that's a huge increase in the amount of load through that leg. So a lot of times people have to do this, and then you can gradually increase the amount of load on that arch of that foot or that leg, and then it won't cramp. So the other thing that you can do if you cramp a lot is drink more water. And then that's one of the biggest reasons for cramping is dehydration. That I definitely, when I work in my garden in the summer in Louisiana, is very hot. I sweat a lot. And then I'll do my workout and I'm like cramping like crazy. I'm like, what is wrong? I'm dehydrated. Yeah, I got to drink more when I'm sweating so much. So that's one thing. And then electrolytes is another thing. You also lose electrolytes when you sweat a lot. And then the other thing is you can increase your magnesium. And so that could help as well. But a lot of times it's muscle imbalances, or just the muscle is just going from, A to Z with the loading, and you got to gradually increase it. So I think that if you can put your foot on something to take some of the weight off that leg, that'll help. Yeah. And you can do stretches and things like that, but that's like a temporary relief. And then you go back and do the thing that made it cramp. You got to figure out how to do the thing that's making it cramp, right? And do it a different way. Because, people are like, well, I need to stretch more. But no, you probably need to do the exercise in better alignment, setting up the biomechanics better, so that you're either not overloading the tissue that's rebelling. And so that might be like if you're trying to push something overhead that's too heavy for you, and then you're hurting your neck. It's just that the weight's too heavy for you to manage. So you got to bring it down some, and so that you can stay in better alignment as you do it. So if you're doing this to get the bar overhead, you're compromising all these joints and tissues up in here, and you just got to bring it down some so that you can control it better, right? And so that's kind of my philosophy for most things that people are doing. And I'm not a big fan of, like, when somebody has a pain during something, oh, okay, we need to stop and stretch. That's probably not the answer. It's more, let's see how the alignment looks and what tissues are getting overloaded and what tissues are not participating enough. And so once you line yourself up, it makes the muscles, and it lets the brain decide what muscles to use. And so that's what's predicting what muscles are being used in an activity is your alignment. And it's just like a big pulley system. And so when everything's lined up properly, then your bones and joints stay lined up, and the muscles around them work well and in the way that they're meant to work. Yeah. And so I know that it's hard to answer those general things. I'm better at looking at something and go, okay, I want you to put more weight to the outside of your foot. See how that does. Something like that too. And how you're loading through the foot makes a difference too. If you're collapsing in on the foot and doing your calf raise, and your knee is kind of loading in like that, if you can put a little more weight to the outside of your foot and then maybe lift your big toe, that's another concept that I like to teach.
Right.
Yeah.
Well, does anybody else? I don't see any other questions. Do you have any that came directly to you?
I didn't see anything. Yeah, so I don't think so.
All right.
Yeah, I think we got everything.
All right. So I really want to thank you, Sherri. I learned a whole lot, and I think that I've seen some appreciations in the chat of people saying how much this has been helpful. So
good.
I really want to thank you. And I'm gonna again put your link in the chat for people.
Mm-hmm.
And again, highly recommend. Sherri does work virtual with people. Do you want to speak at all about how you work with folks if people want to reach out to you?
Thank you. Yes, I have both classes. I was going to share my screen really quick, and you can see the contact information. So here's my contact information. You can go to therapilates.com or go to Sherri at therapilates.com. And then contact me there. If you are interested in a one-on-one consultation virtually, what I would do is set up your camera so that I want you to, be set up from head to toe, fairly good lighting, so you don't have light coming from behind you. And then one of the things I always recommend is you don't wear all white or all black or black or white. Those colors either absorb the light or reflect all the light, so I can't see very well. And then we just talk about your situation. You have some forms to fill out that will kind of tickle your brain for questions and what are your goals and things like that, and what would you like to accomplish. And then what I usually do is systematically take you through an evaluation to find out what is provoking your pain, what is relieving your pain, and how we're going to help you with relieving any pain that you have. Or if it's just building bone and you want to start a program, we start with going through all the skills that you need to have and looking at your alignment, making sure you're doing it correctly, making sure you have the right box, that you have the right equipment that you need to get started. So that can be a one-on-one situation. There's also an opportunity on Fridays that I have an introductory class that anyone can come into. It's like a Q&A, it's a question and answer, it's a skills checklist. You can show me the skills that you have questions about, and then I can help you get prepared for the classes. And it's like a 30-minute class, and there's usually just 2 or 3 people there. And you're welcome to come into that class on a Friday, and it's like a $15 drop-in. And whatever works for you is we try to have lots of different price points for people to get into the program and get started with their bone strengthening program, so that you can do it in a group setting or you can do it one-on-one if you like.
Great. Again, thank you so much. And again, people are like super helpful. Thank you. Thank you so much. Yeah, people are loving it. So thank you.